Hello and welcome back to another episode of Diabetics Doing Things. We're telling the amazing stories of people with diabetes from all over the world. We've been talking a lot about mental health on this podcast, really going back to last National Diabetes Awareness Month. So I'm very excited for our guest today. She's a podcaster, she's a longtime diabetes advocate, diabetes blogger, diabetes community member, and she's a therapist. In fact, she's the diabetic therapist, Allison Nimlos. Welcome to the show.
Thank you so much for having me. I'm so excited to be here.
I'm excited to have you as well. I think we first connected when I was in Minnesota 4 years ago now. I think I was speaking
Yeah.
for a little JDRF event there. Shout out to our JDRF Minnesota chapter. They have been a long time supporters of the podcast and what we do here. And we got to meet and talk at length on that trip. And I guess, just since then, there's been a few things that have happened, but in both of our lives, and also obviously in the global pandemic obviously was a part of that. And now kind of coming out of it, really excited that you also are promoting the latest version of the Diabetes and Mental Health Conference, which we're going to talk at length about later. But that conference is May 5th and 6th of 2023. So at time of recording, about a month out from where we are today. So Allison, like we normally do, let's talk a little bit about your life with diabetes. And even I'd love to talk about early days in the diabetes online community as well, because I think it's so important to know where we came from.
Yeah, absolutely. Well, I have had type 1 diabetes for 29 years, and I got started in the diabetes community in high school. So, as we were talking about before we started recording, sometimes I kind of feel like the grandma in the diabetes community because it's like that's over 20 years that I have been involved in the diabetes online community, and it has changed so much. I was just thinking about this the other day that when we first started blogging, we could keep up with the number of people who had blogs. And I don't think you could try to record the number of people who have blogs and Instagrams and TikToks and websites now. I mean, there's just so many people, so many voices, which is so exciting, so exciting. But yeah, it was super tiny and kind of nascent back in, the I guess mid to late aughts. Is that what they call it?
Yeah.
And yeah, things have changed a lot, but it has been really cool to see that evolution and to see so many more people feeling comfortable talking about diabetes and putting like so much of it was like anonymous back then, and not that things aren't still anonymous, but I think people are feeling more and more comfortable putting themselves out there and talking about diabetes.
I totally agree. And I think, we're 200 episodes on the feed when this goes live, and we're not even close to interviewing even a large percentage of the number of active voices in the diabetes community. And even in the, now 7, 8 years since we've started doing this podcast, the amount of people who are sharing their stories is way up. And I think the community is better as a result. And I think I can confidently say now, like no matter who you are, no matter where you are living with diabetes, there's somebody who is sharing their story that you can connect with. And going, back to the aughts, back when I was first diagnosed and, almost 20 years ago now, that's a different story. And so I'm, in a lot of ways, obviously a diagnosis with diabetes is never good, but at least now there's more voices to follow. There's more amazing people to be inspired by no matter what you're into. And I think that's something to celebrate for sure.
Yeah, absolutely. I mean, I remember when I first started my blog, like one of the things that inspired me was I felt like there was no one in college with diabetes on the internet. And it was like, now there's, the diabetes link, formerly, CDN. And there are so many more people who are able to kind of contribute those stories, and the accessibility to a community is just, it's so much more accessible than it was when I was first diagnosed and growing up.
It's exciting. And I think one of the big wins of social networking and the internet is just connecting all of us folks with chronic illnesses to each other. So with that in mind, we've talked at length and not just here, everywhere in the diabetes community at different times about the impact of diabetes and mental health. And So, for you living with diabetes and also practicing as a licensed marriage and family therapist, let's talk about, let's get past the just that people with diabetes are 3 times as likely to suffer from anxiety and depression, which I think is is a very impactful line, especially when you read it for the first time, because you can see it's like, oh, okay, well, maybe this anxiety and some of this depression that I'm experiencing is normalized, and I think that's really important to use in that language. And so for you, when you're thinking about the impact of diabetes and mental health after all this time in the online space and all this time practicing with patients, what are, some of the things that people with diabetes should be conscious of and try to notice in their life that may manifest themselves as anxiety and depression?
Yeah. Well, I think knowing the stat is really important, but I think one of the other stats that I like to share when I give presentations about diabetes and mental health is actually the prevalence of diabetes distress. The diabetes distress is even more prevalent, like 40 to 50% of people with diabetes at any given time are experiencing moderate to severe diabetes distress. And because diabetes distress isn't a diagnosis, it's not in our DSM, it can often go overlooked because there are not, it's not something that psychotherapists are going to get trained on. And there's not really the diabetes distress scale is a great way to assess that. But it doesn't come up as much in like discussions with like endocrinologists or even like your own therapist if you have one. Um, so I think that can often get overlooked. So what I think very first thing I would want if anyone here is listening and wants to know like what is something I might be able to take away and do with this podcast I'm listening to is to do a self-assessment of diabetes distress. And you can do that at diabetesdistress.org. And no, they're not paying me to say this. I get no commission. But I just think it's a really great resource and insight into the areas. There are 7 areas, subscales, we call them, in diabetes distress that this asks you lots of questions about that. And when you know the source of the feelings, that's when we can problem solve and that's when we can take action and do something. A lot of times, patients, clients that come to me, they know things don't feel great. They know that something feels off. They don't really they don't feel empowered. They don't feel confident. They don't feel, joy or anything like that. And when you have kind of a sense that something is off, but not really knowing the direction it's coming from, it can feel even more disempowering and hopeless because you don't know what can you do. And so that's one thing that I would recommend that people can get started doing it on their own, today to kind of raise their own self-awareness about what their lived experience is.
Well, I also want to focus on like awareness in general. It's like not just self awareness, but I didn't know the diabetesdistress.org existed. So, and I'm pretty informed, and so I think there's opportunity, obviously, to find that awareness of what distress diabetes is bringing to your life. And I think we all can look back at our diagnosis dates for the most part, those of us who were old enough to remember how radically our life changed. But we don't associate that change with why we're feeling the way we're feeling necessarily. Like, we don't always make that connection. I think a lot of it comes back to language and how we talk to ourselves about it. You had a post recently on Instagram that kind of walked through like the importance of language and self-talk and the way that we talk about our diabetes. And I think, I'd love to talk a little bit about that with you in terms of like how thoughts and beliefs can become reality. I'll share a little bit something of my own. In 2021, probably, I started writing myself notes on my alarms. So, like, when you on an Apple iPhone, you have your alarm and it has a label and you can write something there. So, I would write something either just a little snippet or a quote or, a to-do list for like the first things in the morning. So, the first thing I see is, how I start my day. And there was a period where that language was really harsh. And I was like speaking to myself as kind of like a drill sergeant. I was just very, overly I don't know, mean is an
Toxic is
easy
the word you're
yeah,
looking for,
toxic,
friend.
mean, yeah, very directed, like not sensitive and kind of like, we talk about softening edges like with mental health. It was a very hard, direct language. So it's kind of like a slap in the face, like early in the morning. And I changed that, in 2022. I just became aware, conscious of like, oh, the way I'm talking to myself, I really wouldn't talk to anybody else that way. So maybe this is a factor in like why I'm feeling the way I'm feeling. And I think that changing that, softening those edges, and being a little bit more open to myself has given me a little less distress in terms of all of those kind of daily, starting my day on the good foot. So I would love to talk to you about, the words that we use for ourselves and how we can treat ourselves more like a friend than an enemy.
Yeah. Uh, this is one of my favorite things to work with my clients on because I think the idea of being compassionate with someone else, with a friend or family member who's struggling, is very well taught, role modeled, example. Like we really elevate that as we should. But the idea of doing that to ourselves, to speak to ourselves as we would a friend, has a lot of misconceptions and myths around that. People can feel that being self-compassionate is indulgent or it'll make you lazy or it means you don't care, and that being that judge, being that critic, being the, almost a bully is motivating. This will motivate me if I'm really kind of, give myself the stern talking to, I'll shape up, I'll lower my A1C, I'll pre-bolus earlier if I kind of shame myself into it. And what research shows is that absolutely is not true. It doesn't work. It is in all of the research that they have done on this, and there's quite a body of work now. Yeah, shaming and judgment does not motivate somebody into action. And the worst thing is it actually it's harmful. It brings up in us that fight or flight reaction, right? When we have somebody who is harming us, we want to kind of run away. And it's sort of a catch 22 because in self-judgment, we're both we're the victim and the perpetrator at the
Right.
same time. And so, yeah, creating some awareness around the language that you use in response to the things that happen, like a high blood sugar or forgetting to bolus or forgetting to bolus early enough or whatever it is that you think you did wrong and that you want to respond with harsh criticism, is really noticing that pathway, that
Right.
sort of cause and effect. Because I think what a lot of people would probably notice is that when this event happens, whatever it is, this event happens and then they have beliefs about the event. So this is something I talk a lot about with clients, is the connection between beliefs and thoughts. Thoughts are more like things that happen in the moment, but beliefs are like the foundation, like how you are grounded. The beliefs that you have about the event feed the thought that you have in that moment. And then that thought will then impact what kind of response that you're going to have. And the more difficult the thought and the more difficult the response, eventually you're going to go into avoidance mode. That's just normal. There's only so long before you can fight. That's usually what people go into like right away. And not everybody, but that's often like, when you get that harsh criticism from your endo and you'll go, I'll show them, and it lasts for a certain period of time. But eventually, coming from you and for, days on end, it has the opposite effect of what you're intending, which is to motivate, but it actually goes, "Mm, I can't do this. I'm not good at this. This isn't something that I can do. And it's so emotionally difficult. I'm having such a hard time coping that I'm going to avoid. I'm going
Hmm.
to not engage as much. And that's where we see like the distress and some of the burnout happening. So that's kind of the pathway that that can take.
That really resonates with me, I think, from the beliefs and thoughts, because I think often we talk about how thoughts become reality, but we don't understand maybe the precursor to that, which is the beliefs that turn into the thoughts that turn into the reality, and how that is rooted so deeply within us. And I think, like you mentioned, we often don't see ourselves as a entity. We don't, and the way that we talk and think, we don't think of that as an interpersonal relationship much. And so for me, hearing like, well, you should speak to yourself like you speak to a close friend, that sort of makes it really tangible, or at least for me, made it really tangible. Like, oh, well, yeah, that makes sense. Like, I would never. I'm like overly nice is probably one of my like flaws. Honestly, I'm just too nice. But it's like, okay, well, can I apply that to myself? But then on the other side is like, when you're in your body, like your body and your brain are part of the same thing, but your mind is separate. And like that, even that is kind of how your physical body and your mental body interact.
Mhm.
Diabetes is such a personal thing. Like you talked about that resistance, and when we hear something bad or we hear something personal, because diabetes is part of us, at least early on in my diagnosis, whenever anyone would ask me a question, even if it was innocuous, like I would get uncomfortable because it felt like a, something different being pointed out about me, and I think there's like shame, and there's you sort of go reactive, and that first reaction is to be defensive and to put up the walls and to maybe react in anger. For me, at least, when I was much younger, but it can be it's such a personal thing. Hey, your A1C is too high if your endo is saying that to you or whatever the case may be. That feels like a personal attack because it's something that you are managing and going through, even though you're doing the best you can do, ideally. It still feels like a personal failure. And then you have no one to blame but yourself. And you start that negative pattern of just, getting back on that roller coaster of blaming yourself, not making the changes or reacting, and then you're back to the cycle.
But it could be smaller than that, right? Like something you said just really like caught my attention when you were like something personal that you're managing. I don't know if it's just me, but I used to get really triggered when somebody asked me why my pump was beeping because it'd just be like, I am handling it. Like, shut up. Just let me handle it, And I sometimes would come off as rude, but it just felt like not an attack, but just like you're questioning me and my methods and my management. So it can be as small as, oh, are you okay? Why is your pump beeping? Or like, hey, do you need some sugar? Is your blood sugar low? You're acting kind of weird. Like, I personally get triggered by those types of questions. I don't like them, but
Yeah. I mean, the first thing I was thinking is the, belief of the pump beeping or the story. That's another, kind
Yeah.
of common phrase I'll use, like the story you tell yourself about the thing. So if a pump beeping is the story I tell myself about my pump beeping is that something bad is happening, something wrong is going on, and then somebody notices, then we might have this thought of they're judging me for not managing my diabetes because I have a belief that my pump beeping is a bad thing and it's being pointed out and now I feel shame.
or even
Exactly.
for me, it's like I have a belief that I don't wanna be different from everybody else, and I know Rob
Right.
and I don't want anybody to, like, look at me and be like, "Oh, that's the girl with diabetes." So it's like if my pump beeps and someone's like, "Why are you beeping?" Now everyone's like, "Oh, yeah, that's the girl with diabetes."
Yeah.
So that's
Yeah.
more of the
So
story in
belief
my
that
head. Yeah.
being different is bad, right?
Yeah.
If we have a story that we're telling ourselves that having diabetes is shameful, is bad, then whenever we're in a situation where our diabetes might be noticeable, we are going to carry those, we're going to have those thoughts of they're going to think something. What are they thinking? What are they going to do? What's going to happen? And it feels really in the moment, but it comes from a much deeper story. And so that's some of the work that I do and that therapists do in counseling is to kind of look at what are the stories that you're walking around with? How are they manifesting? And then how can we make some shifts so that we have, shifts in those stories so that we have better outcomes?
This is actually a really great transition to my next questions that I want to talk about around self advocacy, because what you're describing, Eritrea, when your pump beeps and somebody asks you a question, now you're in a situation where you have to be your own advocate on a very micro level. It's not the same as when you're at the endocrinologist's office or you're on the phone with your insurance company and you're trying to get a prior authorization for the medicine that they have, that you have a prescription for that you need, but they don't want to cover. That's a different type of advocacy. I think a bigger, and you might be more galvanized to do that because when you pick up the phone, you know what you're going to have to do. You have a little bit of an expectation of what you're going to have to go through. But when someone sort of surprises you with because as we all know, those of us that wear pumps that beep, they beep at weird times, and you can't always decide when they're going to beep. And somebody asking you, that becomes a micro moment of self advocacy. And we as people with chronic illnesses have to advocate for ourselves in many different situations. And I think back to that mindset, it can be difficult to, if you're low on energy or you've had a difficult diabetes day or you're in a high state of diabetes stress, to advocate for yourself even on a micro level. And as you said, Eritrea, like maybe a brisk remark or a rude comment like that you give back, uh, that person has no idea what you've gone through that brought you to that point. They think that they've caused it, and it's almost never the case. So, Allison, I'd love to know like some of the ways that you galvanize yourself to remember to be your own advocate and some of the ways that you discuss that with your patients as well.
Yeah. Well, I think the word that comes to mind hearing this is boundaries. And we actually have a whole session on boundaries at our conference. But one of the, things that a lot of people struggle with in diabetes and like with any client I've ever worked with is on personal boundaries. And it kind of goes back to this kind of what we were talking about with compassion. Like we're sort of trained to be like really nice to people. And the idea of having boundaries can feel kind of mean. Like I can't say no, or they're just, we kind of make, we try to explain it away of like why allowing people to say or do things or ask us things and having to sort of capitulate or participate, even though it doesn't feel good, we feel obligated. And so this question kind of makes me think a lot about how we identify and communicate boundaries of what we are okay talking about, what we are okay being asked, what we are okay participating in. And that can be really challenging for people who, don't have a lot of conversation or a lot of opportunities to really think about what their boundaries are and to learn how to communicate that in, I think, respectful and effective ways. Because I think most people just think of boundaries as being kind of those like sort of mean little retorts that don't even really feel that good once you're done doing it. Like, you may have set a boundary, but you don't feel that great either. And I always tell, my clients like setting boundaries protects the relationship. It helps to guide the relationship so that the people in your world know how to relate to you, know how to
Right.
support you, know how to help you, and that that you are guiding them, and vice versa, that they will guide you on their boundaries and what they need. So that's something that I would encourage people to be thinking about.
I want to talk a little bit about boundaries because I think sometimes it can be really uncomfortable when you make new boundaries or you decide what your boundaries are and you sort of verbalize those because uh, you're prioritizing yourself. Like that's not a selfish the negative connotation selfish. It is a selfish act because you're trying to help yourself. You're trying to create a space for yourself. And I think sometimes it feels like a four-letter word. It feels like a bad word when you're like, "Hey, I don't do that anymore," or "Hey, it can make people uncomfortable. And I think part of that is just because so few people these days have those established those boundaries for themselves or are aware of, what things are good for them or not. And we can kind of talk about this like on a broader scale. Just we talked about diabetes distress, but like there are a lot of similarities that people with diabetes deal with on a regular basis regarding their mental health. And I think a lot of them stem from boundaries, either ones that we haven't established or ones that are encroached upon by external factors or ones that we maybe aren't as honest with ourselves about or aren't able to commit to. So, what are some of the similarities that you see with, patients, whether, differing levels of diabetes distress or just dealing with diabetes burnout or, diabetes affecting their mental health?
Yeah, well, one thing that comes to mind is the idea that of being a burden to other people. And so we may not not advocate for ourselves with our family or with friends saying, I need some help, I need some support, I need to do something differently, or I need you to help me to do something differently because we don't want to be a burden. And so, yeah, that's something that I see come up a lot around the idea of, being able to kind of speak up for ourselves and how that contributes to diabetes distress. And then of course you have things where you're being, you feel like you're being asked to do something, oh, we want to do something, and maybe it feels like not the right decision for you, but you don't want to say, you don't want to refuse something that, you know, grandma cooked and say, no, I don't really want that right now,
Grandma
or
boundaries are tough.
I'm not gonna have seconds or whatever it is. And and that can just feel like, well, I can't say no, like, and because we are sort of afraid of what people are going to do or say or be offensive. And so that across the board leads to a lot of a lot of distress for anybody. If that's the story we're telling ourselves, that saying no is offensive and it should be avoided.
And I think no is a boundary. And you had a
Oh, it
post
is a
about this,
boundary. Yeah.
you had a post about this recently, and friend of the pod, she was on one of our first 15 episodes. Melissa Urban, formerly Hartwig, is like she wrote a book on boundaries and talks about no as a complete sentence. And sometimes just saying no and not having to explain and not burdening yourself with having to explain is a strong boundary, a strong foundation. It takes practice though, because it really does feel uncomfortable. Because I
Yeah.
think from a societal perspective, people don't we we don't talk about saying no as an option very often. you know, say no to drugs for sure. Like obviously is like, has a big campaign behind it, but that took a long time too. And like saying no to peer pressure and saying no to things where you try to fit in. And I also think for young people who are trying socially to fit in, it can be very challenging to say no in a high pressure situation, whether socially or, just fun or not wanting to explain. I've talked about it on the podcast before, but a few years ago on 7-Eleven day, I didn't get a Slurpee. My whole team went to a 7-Eleven and I didn't get a Slurpee. I got a Coke Zero because I had like 12 units left in my pump and it was in the afternoon. I didn't want to deal with the roller coaster of bolusing for a sugary beverage. Sorry, Slurpee. But people commented like, "Just get the Slurpee, just drink the Slurpee." And I was like, "Well, that's my choice. I don't have to do what you want me to do." And it was a really weird interaction. So, if I think I blocked that person. If they're out there, I will beat you. This is bottom line. So,
Will beat you.
I will beat you. But like at the same time, I think like it did feel weird. I was like, okay, well, this is such a strange thing for people to be upset about. But again, I had to worry about myself and what was right for me in that moment. And I think, on a day-to-day basis, that can be challenging. And especially when you're, dealing with boundaries in relationships that you really care about.
Yeah.
It takes an extra step of recognition.
Yeah, and sometimes it's not even saying no, it's saying it's not about even saying no to, the food. Sometimes it's that you have said yes to something and people want to know, well, why? Why can you eat that? And why,
Absolutely.
I thought you had diabetes and all this stuff. And so sometimes it isn't because you've said no, it's because you're saying no to a type of interaction that doesn't feel healthy, that doesn't feel safe, and now we are able to kind of slow down and talk to somebody and say, even that I understand maybe why you're asking this. And maybe, if you want to, you can say, like, I appreciate your curiosity. Thanks for your interest or your care. But, and then you set your boundary of, talking about my food choices isn't something I do.
And I think that is such a succinct way of doing it. I think a really strong way of operating. And I think that,
I've had a lot of practice.
well, oh, right. Well, which is why you're here. And I think, for somebody who maybe has only done that one or two times or has thought about it but not committed to it, it is an option. It does feel uncomfortable. But I think sometimes, and this is like an improv thing that I haven't thought about in a while, but you kind of have to follow the fear sometimes. If you're afraid to set that boundary, and you feel it in the butterflies in your stomach or, just that really kind of uncomfortable feeling, that's your brain warming up to do something new. And I think like kind of following that fear sometimes will lead you to a place that you don't know. And we talk about a lot. I think online advocates do this extremely well. Every opportunity that you encounter a stigma or a predisposition is an opportunity to educate. Now, you may not have energy to educate at that particular moment, and that I think is where some of the conflict and the difficulty arises. But by learning to, say how you feel and be aware of why you feel that way, even to a total stranger, you can be successful in those situations.
Yeah. Well, that line reminds me of something I often say, you cannot be comfortable at something you don't do.
Mm,
If you're avoiding something, a lot of clients, a lot of people that I work with, they're like, "Well, I'm just, I'm not comfortable with that yet. I'm not comfortable." And so I'll ask them like, "Have you ever been comfortable and totally confident in something that you've never done?" And then they go, "No." And it's like, that's the idea. We are not going to feel really like confident and like knowing the outcome to something like the first time you are doing something, or even the first handful of times, like you're building that skill, but we don't build the skill by avoidance.
my therapist, and shout out to her. I won't name her, I guess, but I could.
I don't think you're supposed to.
Uh,
You can.
I was
She's
gonna
your
say, can you?
you
she's
can.
not a she's not a secret spy. Yeah, there's no yes, there's no like
Oh my God, what a
patient
flex. I'm Rob House.
provider. I know. Well,
What if I'm Rob House therapist? What a flex.
oh my gosh. Well, she was talking to me about we've been working together for 3.5 years now. And she said, if you had done anything almost every week for 3 years, anything else other than what we're working on, you would not be surprised that your skills are better at that than someone who has never done it. But when we look at ourselves, we look at things like mental health and therapy and practice and mindfulness. We don't associate those the same way we would with like skill acquisition of like nailing a hammer or like building a birdhouse or something. Like you're, and I think that's a really interesting way. I'm not sure exactly why. I think it's just probably human nature of like we just don't we're not as good at affirming ourselves the work that we're doing internally because it's not tangible always. And like you said, but if you don't practice it, if you don't put it in practice, you'll never be good at it because the first time you do something, anything, it's always worse than the 100th time you do it. I don't know, maybe that's too like generic, but I think also the reason this is connecting for me so much is because so much of my life is spent in social media content, not just for myself but for my clients as well. And I can't think of any other like type of output where we assume on day one the first thing that we put out there is going to go be the best post of all time. And we're disappointed that every post didn't go viral, even though it had no business doing that, and we're just getting started. And awesome creator, Mr. Beast, has a really clickbaity kind of talk where he says like, "Oh, you want to be famous on YouTube? Make 100 videos. No one's gonna watch them, but on that 101st video, something magical will happen, and it'll be so much better than video one that you'll have found something, you'll learn some skill, and you'll be in a different place than you were prior." And I think
Mhm.
like that's so much of what we're saying is like going to therapy once or going attending one conference is not going to change immediately all of the way that we deal with our diabetes or our diabetes distress, but it does put us on a path where we can practice and return to that practice to improve that skill set and that commitment to ourselves. So I don't know, that was kind of a windy road answer, but
Yeah,
I
absolutely. I definitely, and I think in the diabetes world, one place where I see the sort of the mental and the physical go hand in hand is with hypoglycemia. And so many people I work with have, fear of hypoglycemia or hypoanxiety. And so they go, "Well, I felt anxiety, so I did something," right? So there's this link between thoughts, emotions, and behavior. And when they tried to, not maybe eat as much, or maybe it's the reverse, it's trying to pre-bolus a little bit earlier, but they were really anxious. And they go, "I was so anxious, so I didn't do it again." And I was like, that's missing the point. The first time you are going to have anxiety, but the more you do it, the anxiety will it's not a light switch. It's not just gonna go on and then off. It's more analog than which is, pretty old school, the dials, right? It's a you're gonna kind of dial down the anxiety that you feel in situations, but it's something that is gradual and over time through exposure to this new way of thinking and behaving. And the outcome of seeing that you were okay is the thing that starts to override the old story.
Mm.
So, overriding the old story is really hard to do. We actually have to do some actions in order to start to have some evidence to rewrite, because that old story is so sticky, and because it has been the story, we have a lot of evidence for it. We have a lot of evidence to support that.
And we're familiar
Um,
with it.
and we're
We know
familiar
the
with it.
story.
It feels safe. There's a lot of things that feel like pretty normal and natural, even though you probably cognitively could see there's some issues with it. But a lot of people want to just work on the story first. They're like, I'm just going to change it. And they find so much resistance to that. And it's because to really change some of the story is to go, I actually just need to try the pre-bolusing to see that it's going to work. I can't tell myself ahead of time that the pre-bolusing is going to work, because I mean, that's faith, I guess. You could just try to do that, but to really feel confident in something and to really start to override some of those grooves. I often describe it as, and maybe that's because I'm a Minnesotan and I drive in snow all the time. We still have snow outside, by the way. I think of it as like grooves in the road, right? You get grooves. You think something over and over and over again, you start to get grooves in the road. And to make new grooves, to shift, takes time to do that. But we actually have something it's called neuroplasticity. And
Yes. Talk that talk.
we actually have the ability to create new pathways of thinking. The old pathways don't necessarily go away. You may actually always sort of notice that like little urge to like eat a little bit more, or maybe like not pre-bolus quite as much, but eventually you get more and more comfortable and it becomes more automatic. It becomes more habitual. And so that's really where I see like the mental and the physical and the distress that sort of links the two. That's really where I see it show up so much for the people I work with.
You touched on so many important things
I
there.
do. That was so long.
That was, I think we could unpack that for a series of episodes, and it would be an absolute pleasure to do that. So, mm, let's revisit that on another day because we have some really deep things that we need to cover here. But I do wanna focus on the analog really quick because you talked about we are as humans are analog creatures. Today at 2023, we are living in a mostly digital world. Most of us sit most of the day. We don't go outside. We're on phones. We're on screens, and um, we're learning slowly that some of that is bad, and that volume at which we are addicted to that those things are bad. And I kind of want to get into that return to the analog that I think we're seeing, and that so much of what we do and what's good for us from a diabetes, but also just holistic human health perspective is in the analog. It's sleeping, it's breathing, it's drinking water, it's getting sunshine on our skin and our eyes, going outside and moving a little bit. And again, like kind of as an athlete benefited from unknowingly having to do that and building those pathways and building those tracks in the snow early in my life so that they're serving me well now and they're just part of who I am. And that is a huge advantage that I just lucked into. And on the other hand, I do see, especially for our younger, community members who were born into this age where from a young age they were downloading things on phones and iPads and TVs, and their relationship with technology is much different. And so they're experiencing the world differently than we did. And it wasn't even really that long ago that we were, in the same space as them. And so, those levels of distress and those patterns and those stories are so different than ours. Some of these things that are real basic to us because there weren't cell phones when we were children to play games on, that we, went outside and played with our friends and played make believe in a grass field, and some of us, and that was like the highlight of our week. And so, like, those types of things, like in returning to that analog, that's obviously an extreme example of returning to childhood. But some of the things, like during the pandemic, there was a real rise in awareness of how good walking is for you and just going outside, because that was really all we could all do for a while. That was, a safe, socially distant way for us to get outside. And, I saw in my own neighborhoods just more people walking and just going outside than I'd seen in a long time. And um, there's no magic to walking. It's an analog thing that our body moves. We get some sun, we get some air, we drink some water, we get out in nature, and that is a positive benefit. And and a return to analog and kind of that rewiring. So I know I'm rambling, and this is the part of the podcast where I typically do that, but I do want to focus. I know Eritrea has another question for you before we move on to promoting the conference, but I really find this discussion of neuroplasticity and relearning and changing our story to be so valuable. So
Well,
thank you
my
for
question's
digging
about the
into that.
same thing. Like, my question's about the same thing. So I have a tendency, and I did a poll on my Instagram a few months ago where a lot of people agreed with me, where I do not trust my technology enough. So, like, when my pump starts saying, like, your blood sugar is 90 and dropping, I will suspend my insulin, even though I'm in an AI hybrid closed loop system. So for those of you that are in something similar, it's like a Tandem, Dexcom, the Tide Pool one, or like the Riley Link
Or a Medtronic one.
or Medtronic one. There you go, plug. But the point is that, like, I have a really hard time trusting my technology to do what it's supposed to do, and that gets me in trouble all of the time because I'll suspend my insulin, then I'll treat the low, then I'll resume my insulin once my blood sugar is rising, but now I'm chasing a high. So it's like, how do I rewire? Because that's my question. Is like, I have a therapist sitting right in front of me, give me that free therapy. How do I rewire my brain to stop doing that? Because I'm missing out so much.
Well, as I tell lots of people, I am a therapist. I am not your therapist. Uh, so, so
Do
this
not confuse podcast for therapy, by the way.
yes, no, yeah. But I think that's a great question, and it's certainly something that I think a lot of people experience, right? Really intense hypoanxiety that just doesn't doesn't just go away with a little bit of practice, right? And I have worked with clients who are like that. And another topic that we're going to have at our conference is trauma and diabetes. And so, as I'm not going to diagnose you with trauma, but what you described may resonate with people who have experienced a traumatic low blood sugar, or really trauma is a word that gets used a lot, in a lot of different contexts. But basically, what it does is it's an event that can kind of instantaneously rewire your brain. So rather than something happening kind of slowly over years, can well, I mean, there is that kind of trauma, but the trauma that a lot of people who have low blood sugars will have is an episode where we suddenly do become very distrustful of that, the treatment is going to work because the low lasted for an hour, or that we dosed and we dropped so fast and we weren't expecting it. And again, we can have sort of like long term trauma that can do this too in different settings of life. But I think the idea of being traumatized in diabetes is something that doesn't get a lot of recognition. And it can be really difficult when endocrinologists and diabetes educators are sort of promoting, well, you just need to take your insulin, or you just need to pre-bolus, you just need to do all of these things. And they're not seeing that there may be an event that has happened, or a series of events, a series of memories that are being coded a certain way that are now influencing our beliefs, our thoughts, and our actions because of an event that has already happened. I often describe it as sort of the past living in the present. that something that has already been is really influencing what is happening now. And again, this is not sort of a diabetes exclusively to diabetes. I think anybody who's experienced trauma probably knows a little bit of what I'm talking about. And there are trauma therapies, things like EMDR, eye movement reprocessing. I'm not trained in EMDR, so I always forget what the last letter is. But EMDR, ART, which is accelerated resolution therapy, those are a couple of there's somatic experiencing. So those are brain spotting is another one. Those are some trauma modalities that
EMDR is the eye movement desensitization and reprocessing. There you go. Sorry.
EMDR. Yeah, I
It's
reprocess
reprocessing. Yeah.
desensitization. EMDR. I was thinking EMRD. I don't know. My brain does thinking it in
Acronyms are
my
tough.
head. Thinking it. If I wrote it out, I'm sure it would have worked. But I was thinking it in my head, and both of the EMDR and accelerated resolution therapy are both kind of eye movement reprocessing modalities that help people to sort of it's not like I should say it's not like eternal sunshine of the spotless mind where you're like forgetting the memory. The memory's gone. That's not what they do. But they basically take a memory and they sort of adjust our emotional reaction to it so that things that happen in the present aren't so triggering, that things can feel a little safer, a little bit more okay. And so I would definitely, recommend, checking, getting a consultation, checking that out to see if somebody listening is experiencing this or you are experiencing this, can learn to see if that might, ask your doctor if EMDR is right for you, you know, because it's hard for me to say obviously on a podcast, but there are modalities that target that support these experiences that people have. And I think that is one of the things that's been unfortunate about the conversation of mental health within the diabetes healthcare space is the fact that a lot of healthcare providers just want to work on the physical and the biological. They just want to work on insulin adjustments and like, let's add a medication or something. And they aren't really looking at what mentally is happening.
Mm.
Uh, because some of it is not going to be just something that you can self talk your way out of. Trauma usually needs a lot more professional support than I think people recognize.
Well, I think too, new things are uncomfortable. I also think we're learning dramatically more about the human body and mind and brain on a daily, weekly basis. It's like that, and I'm sure there's a principle for it, or there's a chart that shows like how accelerated it has become. But we're learning. We just know so little about our physical and mental, spiritual bodies and how they all work together. And we're learning more every day, but we're just scratching the surface of what's there. I do want to kind of shift a little bit because we have an event to promote. We have an opportunity for our listeners to benefit from a lot of the principles that we've discussed today in a 2-day conference next month at the time of recording. So May 5th and 6th, 2023, the Diabetes and Mental Health Conference. For those listening who want more information, we have it listed on our diabetes mental health page. So diabeticsdoingthings.com/mental health. So you can check out the links there as well. But Allison, while we have you here, who's the conference for? Who should attend and what can attendees expect? We've talked a little bit about some of the paths and some of the sessions that are going to be at the conference, but give us the pitch. Who should go to this conference?
Everybody. Oh, and we were very, and I don't say that sarcastically, we were very intentional about wanting this conference to have something for everybody because there isn't a conference that does this anywhere else. This conference has two tracks. It has a track that is geared towards patients and a track that is geared towards providers. And that track, the one for providers, does offer CEUs. So if you are a healthcare provider who is listening to this, an RD or an RN or a CDCES, you can get some CEUs. Um, and and then even within the patient track, we have several sessions, I think are one in particular is for parents. Most of them can be watched by parents because I think the more you understand about the experience your children will grow into, the better a parent you will be. So I encourage parents to watch all of the tracks or all of the sessions in that track. And then same with the providers. I think the more you understand the lived experience of your patient, the better you will be able to support them. Going to a session where they are going to learn about boundaries can be really helpful in you kind of guiding some of the conversation. Um, so the conference is really for everybody. We have such an amazing lineup, which is at our website, which I know is in your show notes. So I won't list out everybody, but our keynote speaker is Dr. Mark Heyman. And we also have our welcome keynote is Mila Clark, and our closing keynote is Adam Brown. So just, two, phenomenal people in our community. Adam has actually become a therapist since working at Diatribe. Not a lot of people know that, but he is actually transitioned out of Diatribe and into our world, which I'm really excited about. And a big thing that we do every year is our panel every year. This is only our second year, but it's a big thing that we do. We do a panel. This year it's going to be on the first night. And this year we are going to be talking about shame and stigma. So very good continuation of a lot of what we talked about earlier today. We have Susan Guzman from Behavioral Diabetes Institute, Jane K. Dickinson from Columbia, and then Tiara Smith and Felissa DeRose and Renza Sibilia, who are just been phenomenal advocates in the kind of world of stigma and shame with diabetes. So those are some of what I'm looking forward to. And then of course we've got a session on trauma, and we've got a session on boundaries. We've got a session on everything. And I think a lot of that comes down to the fact that because this is dedicated just to mental health, we're really able to break things out a lot more into the subtopics of diabetes and mental health. A lot of times in previous years, before COVID, when I still traveled to speak, a lot of the conferences had one session,
Right.
diabetes distress or mental health or something related to psychosocial issues. It was one out of, the 6 or 8 that were at an event.
And you might be up against like a really exciting session with,
Right.
with
And
a
then
really cool speaker.
sometimes you had concurrent sessions happening. So you didn't even have everybody there. Sometimes you were the only session, but it was still like 45 minutes or 50 minutes to talk about everything mental health. Like that was,
Right.
you could barely scratch the surface. And I think that was really the inspiration for me to kind of partner with Sarah Adams to put this event together, because I didn't like that I only got 45 minutes. Like I was like, that's not enough time. And now we have a day and a half to talk about it, to really kind of dive into some of the nitty gritty. And we got a great reception last year, and we are already getting a lot of good feedback, just people seeing who's on the schedule and like the different sessions that we're going to have. So I'm really excited to see how it all comes together.
Well, we are as well. And like you said, it is on our website, diabeticsdoingthings.com/mental health. And you could find the link there. We'll also include it in the show notes and promote it with the Instagram post as well. And this is going to be going out at time of recording next week. And I totally agree with you in terms of like, we often refer to diabetes as a disease with too many inputs. And so many of those inputs are centered around the mental health side of things. So to be able to have options for multiple tracks and multiple sessions within one place, I think is a tremendous resource, and meets a really big need here in the online community and the greater community as well. So Tell a friend with diabetes to tell a friend with diabetes about the Diabetes and Mental Health Conference, May 5th and
Yeah.
6th, 2023.
And it
Uh,
is recorded. So
okay.
I wanted to throw that out there in case you already have plans. Uh, It is recorded. The sessions are available for a whole month after the event is over. So you have lots of time to go back and watch the keynotes and the panel and the sessions. So no need to worry about like having to necessarily be there live.
Awesome. Well, Allison, thank you so much for coming on the show. It's been long overdue, and thank you also for being a trailblazer in the diabetes online community and one of the OG bloggers that we, so many of whom we've talked to over the years and become friends with. So thanks for all that you do for people with diabetes. And you're the diabetic therapist on Instagram, and we'll tag you there as well. So be sure to give her a follow. And thank you so much for spending the time with us today.
Thank you so much for having me. This was so much fun.